Welcome to the Western North Carolina School of Massage. My name is Dr. John Morgan, and today we're going to learn about golfer's elbow and carpal tunnel syndrome, what it is and how to treat it. The forearm muscles on the anterior arm are called the flexors, and they commonly attach to a bony landmark here called the medial epicondyle. And when these muscles get overused through repetitive gripping or using scissors or pulling weeds in the garden or holding a golf club, they can start to develop hypertonicity and start to create collagen degeneration at their attachment site on the medial epicondyle. And although it's often called medial epicondylitis, which indicates an inflammatory process, there's very little inflammation here, and is typically and properly known as tendinosis, which is the breakdown of connective tissue at this location. So massage is indicated for golfer's elbow. Deep, broad, compressive gliding strokes to the wrist flexors help reduce hypertonicity, enhance the pliability, and decrease the tensile load of the flexor tendons. So we're just using some nice, broad, deep gliding effleurage to the attachment site. These techniques are also effective for identifying and treating trigger points within the muscle. Trigger points in the muscle can refer all the way to the wrist, so it can sometimes be misdiagnosed as carpal tunnel syndrome when it's actually just pain referral from the flexors to the wrist. For example, flexor carpi radialis can refer here all the way to the middle finger, flexor carpi ulnaris to the ulnar aspect of the wrist. Flexor digitorum superficialis can refer to the fingers and all the way out, and some clients will even complain of pain extending beyond the fingertips, what's called lightning pain. So you can get trigger finger or lightning pain or medial epicondylar pain from hypertonicity in the wrist flexors. Is typically involved in playing golf because when the wrist flexors are engaged in a very concentric, which is a shortening of the muscle, very concentric gripping action, then when you swing the club toward the ground, when you hit the ball, there's a sudden eccentric load to the grip muscles, and it's also exaggerated because of the long length of the golf club. So it puts a very heavy load on the flexors. Now, other than deep gliding effleurage strokes to the flexors, stretching, so we can add a stretch to the muscle as we effleurage, a passive stretch. Another treatment approach is corticosteroid injections. However, they often just yield short-term benefits and pain reduction. Their continued use long-term can actually create a breakdown of connective tissue and tendon failure. So use sparingly. Using power tools, holding hammers, any kind of manual labor can overload these muscles, like massage therapy. Notice that I'm using the flexors every time we press in with the fingers. We're doing finger flexion, which is using these muscles. Here is the flexor carpi radialis muscle, the palmaris longus, and the flexor carpi ulnaris. And there are actually several layers. These are just the three superficial muscles. Another technique to apply a treatment approach is a contract-relax technique. So we can put our partner into a gentle stretch and then breathe in and resist. She's contracting. Do the count of 5 seconds. 3, 4, 5. Exhale and relax. And take it further into a stretch. And continue again. Press. Breathe. 1, 2, 3, 4, 5. Exhale and relax. And take it further. You want to encourage your partner to continue doing that at home. The next treatment technique is deep stripping friction cross fiber across the tendons of the flexor muscles to stimulate collagen production of the damaged tendon tissue. And remember, stretching should be regularly performed by your partner at home. Frictioning in different areas. Now all these muscles cross the wrist and attach to the palm and to the fingers. The tendons pass through a canal here called the carpal tunnel, and over this tunnel is a transverse carpal ligament, and just underneath this transverse carpal ligament is the median nerve. The median nerve innervates the palm, this area of the palm, the thumb, first and second finger. This is median nerve innervation. This is ulnar nerve innervation, both the front and back of the fourth and fifth fingers and the side of the hand. And this is radial nerve innervation right through here. Thumb, finger, and part of the middle finger. So again, this is the median nerve through here, ulnar, and radial. Now, we don't want to be compressing straight on the median nerve. It's already being compressed enough. How can we assess to see if it is a carpal tunnel-like symptoms? We can have our partner do the Phalen's test, which is bringing the wrist together for 60 seconds. And if they experience numbness and tingling down the median nerve innervation, that's a positive test sign for carpal tunnel. Also, Tunnel's test, tapping on it. And again, if they're feeling a mild numbness or electrical shock going down here, it's an indication of excessive pressure. I think about 90 mm Hg amounts of pressure here. The only true way to actually get an official diagnosis is through a nerve conduction test. So often we'll recommend a person go get a nerve conduction test to get a definitive diagnosis. So while we do know this transverse ligament is here, we can do some myofascial techniques, a nice spreading here on either side. And it's suggested that this may be beneficial in treating carpal tunnel syndrome. Now, a primary part of the problem of carpal tunnel syndrome also involves hypertonicity and overuse in the flexors of the wrist and hand. So once again, gliding on these muscles while adding a passive stretch is indicated for carpal tunnel syndrome. Encouraging your partner to rest and let these muscles reduce their tone and modify their hand grip or their sports activities to use the muscles in less of an overload pattern. Also, the muscle can develop trigger points, and so coming in here and finding areas of hypertonicity in nodules or bands and compressing on it to mild discomfort. Let me know when you feel that by saying just right.
That's right.
Okay, we're at mild discomfort, and when the sensations subside, will you let me know by saying it feels better?
It feels better.
Okay. So reducing trigger points in the muscle, which again commonly refer to the wrist and to the fingers, is also another recommended treatment approach. And these are just some basic techniques to apply for Garfield's elbow and carpal tunnel syndrome.